Thank you for joining the wellness program at Duren's Pharmacy. Today we will be discussing the plate method, meal planning made simple. During our discussion today, we will learn about calorie needs, the 3 sources of calories in our diet, and how to use the plate method to keep our diet well balanced and healthy. The first question that many people ask when first starting out is, how many calories do I need each day? This is a really hard question to answer without first gathering some additional information. The calorie needs of each person can be very different and depend on age, gender, current weight, activity level, and whether the person wants to lose or gain or maintain a particular weight. There are many online resources such as livestrong.com and MyFitnessPal that you can use to determine the amount of calories you need to consume each day to achieve your particular health goal. The program will ask you several questions to give you the most accurate estimate of how many calories you need. Check out these resources or ask one of our pharmacists to help you calculate your personal calorie needs. There are 3 main sources of calories. These include carbohydrates, or carbs for short, protein, and fat. Let's talk a little about each of these. First, let's talk about carbs. Carbs have 4 calories per gram. Carbohydrates should make up about 50% of your total daily calories. In other words, if your calorie goal is 2,000 calories, about 1,000 calories for the day should come from carbohydrate foods. Carbohydrates include sugars such as sweets, regular soda, and fruit juices, starches such as breads, pasta, and potatoes, and fiber such as whole wheat, oatmeal, and granola. The next source of calories we will discuss is protein. Protein provides 4 calories per gram. Examples of protein include lean meats such as chicken, fish, and lean cuts of beef. Others include egg whites, Greek yogurt, protein shakes, dry beans, and peanut butter. Approximately 30% of your daily calories should come from a protein source. The last source of dietary calories comes from fat. Fat is the most calorically dense, coming in at 9 calories per gram. That means that you get double the amount of calories by eating a gram of fat than you would from eating a gram of carb or protein. Common sources of fat include pork and fatty cuts of beef, whole milk, cheese, butter, cream, and cooking oils like vegetable oil and lard. Less than 20% of your daily calories should come from a fat source. So what is the plate method all about? The plate method is a simplified way of fixing your plate with the nutrient-rich foods that you need. If you remember back a few years ago, the food guide pyramid was used to help people with dietary decisions. However, the food guide pyramid was difficult to understand, so the plate method was designed to simplify the way that we look at planning nutritious meals. First, start out with a 9-inch dinner plate. A typical dinner plate in America is about 11 or 12 inches. Go through your cupboard and find a smaller dinner plate. Research has shown that we eat less when our plate is smaller, and even though less food fits on the plate, it appears that there is more because the plate is smaller. Next, imagine your plate is cut in half. Then imagine that one of the halves is cut in half again. Fill half the plate with non-starchy vegetables like salad, green beans, broccoli, cauliflower, carrots, and tomatoes. The non-starchy vegetables tend to be brightly colored. In one of the smaller quarter sections, pick a starchy vegetable or side item. These items include potatoes, corn, rice, noodles, and breads. The starchy vegetables tend to be white and bland in color. On the last quarter section, pick a lean protein source like chicken, fish, turkey, or lean beef. Don't get too carried away though. with the 16-ounce top sirloin, the recommended serving size is 3 to 4 ounces. 3 to 4 ounces is about the size of a deck of playing cards. Let's look at an example of how to fix a plate using the plate method. First, fill half the plate with non-starchy vegetables such as salad and green beans. Next, choose your starchy side for one of the quarter pieces of the plate, in this case a roll. Then pick your protein source, such as chicken, for the remaining quarter of the plate. Be sure to include reduced fat or skim milk as a source of calcium for your diet. And lastly, add a piece of fruit such as an apple or banana. Being from the South, we were all likely taught to clean our plate. So what can we do if we go out to eat and our portion of food is huge when the server brings it to the table? Ask for a to-go box just as soon as the server brings out your food. Go ahead and divide your meal in half before you begin eating. Take the other half home for supper or lunch the next day. Also, order water or unsweetened tea to avoid sugary beverages like sodas and sweet tea, which contain huge amounts of carbohydrates and calories. Be on the lookout for these upcoming videos. Next week's video is called The Medicine Cabinet, Treating Hypertension. We will take a look at medications used to treat high blood pressure. Don't forget to stop by the pharmacy for a blood pressure check sometime this week. Contact Make and Carol, pharmacist at Duren's, if you have any questions or need assistance with your medications. You are invited to join us at our monthly Sweet Spot meetings. We meet the last Tuesday of every month at 7 p.m. at the pharmacy. Bring a friend and join us as we learn about diabetes. Thank you and have a wonderful week.